Hi, welcome friends. This is Dr. Jaitly from New York on MuniMeterHealth.com. That's the website we have for our learning and teaching of human heart and its care. Today's topic on this video is carcinoid syndrome. What is it? It's a fascinating condition, as a matter of fact, not known fully yet, even now, but the quick data that I can talk to you about in these 5 to 7 minutes on my video minutes clearly will define how ambiguous this condition can be. So one, it's not cancer, but that's why it's called carcinoid. But it does have some features, if you will, of a carcinoid or cancer type features, if you will. One, it is produced by argentifin cells, which are normally in the GI tract. Here on the right panel, I'm showing you the stomach and the intestinal linings, for instance. Now, the intestinal linings have obviously their own epithelial cells, but there are argentifin cells which are normally present. But when they go in what you call mitotic numbers, automatically there is a primary tumor that may present and starts secreting serotonin and many vasoactive substances. Now, these vasoactive substances from the stomach and intestinal linings will eventually end up into the liver, because as we know, the first stop is whatever we do in the GI tract, automatically the liver is the next stop. Now, this is the big metabolic factory. That's where the changes and the absorptions and the conversions are happening biochemically. So it is actually called the first filter. So once this happens, after that, normally it comes into the right side of the heart. Now the flow is to the right side of the heart, so the valves from these vasoactive substances to be affected are the following: tricuspid valve and the pulmonary valve. The pathology is the following. It starts with an endocardial thickening first, later on becoming fibrous plaques into these valve leaflets. Now, and then later on turning to become retractive, more retracted leaflets as well. So you can only imagine if these retracted leaflets are present, at that point you will only expect some regurgitation. That means there will be a leak in the valve. Now, valves are supposed to be opening only on one side, correct? So the blood flows from the top chambers to the bottom chambers. And here they're moving into the pulmonary circulation. From here it's moving into the aorta, into the systemic circulation, and that's how the circulation continues. So the valves are like doors. They open only on one side, but in this setting, what happens, because of the retraction and the fibrosis, as well as the plaque formations on these valves, the valve leaflets become more retracted. So there is regurgitation happening. So there's a profound TR, if you will, a tricuspid regurgitation, and profound pulmonary regurgitation. So invariably, it's the right-sided failure, heart failure, that occurs. Left side is kind of saved, if you will, or protected, because as the vasopeptides traverse the lung circulation, that is the second filter, and by then the vasopeptides are already dissipated, and none of them really arrive to the left-sided circulations unless there is a PFO or there is an ASD. Then of course the left-sided can be involved as well simultaneously, like the right-sided valves. So it is very, very important that we have these as our presentations. Now, primary ovarian tumors also present with carcinoid heart disease, and they also secrete the above substances, namely the serotonin and many vasoactive peptides along with it. Now, in the GI system, when it presents, it's normally causing diarrhea, and there's flushing, and there's some headaches involved. So it's all because of the serotonin going into the systemic circulation here. But then also it causes wheezing, because once the lungs get involved here on the right side, then the wheezing will occur as a result. So some of these patients present with profound headaches, flushing, their face just turns red, and their whole skin, everything feels just warm. They may be sweaty, and they could be mistaken like they could be having a panic attack. Diarrhea, which is very, very prevalent, may suggest that, again, Diarrhea again sort of compounds the anxiety attacks because there's an increased bowel movements and severe anxiety panic spells, and wheezing too. So everything could be very, very confusing, and now you see how innocuous or insidious the confusing presentation it can be. Now, treatment is profoundly, documented by octreotide, which is again a serotonin vasoactive, what you call inhibitor, and the sandostatin is the trade name, but octreotide has really changed the longevity and the quality of symptoms in carcinoid heart syndrome. One sometimes in the liver actually causes can offer a resection, a partial hepatectomy we call it, or even a hepatic artery embolization. If we know that a portion of the liver was showing some primary mets or is showing some signs of argentifin tumor, then at that point one can do an hepatic artery embolization, and automatically this just auto amputates. Liver transplantation is the next thing that one does, but the diagnosis is frequently made by liver scans. Echocardiography will demonstrate obviously the tricuspid regurgitation, pulmonary regurgitation, and of course very, very thickened tricuspid and pulmonary valves. Octreoscan has been advised. Biopsy, certainly the liver biopsy can be done to confirm the diagnosis. And then the 24-hour urine for 5-HIAA we call it, and hydroxyindole acetic acid, if you will, but the long name is 5-hydroxyindole acetic acid, but 5-HIAA in the urine is extremely high in these individuals who have serotonin-producing argentifin tumors. I thank you for the attention. I know it's pretty intense for non-doctors, if you will, but there are viewers, I'm sure they would be enjoying this as well, because time and again one comes across these symptoms, and it's a good idea to go back and talk to your doctors and discuss more freely what their testings are about, or if you have been recommended to be worked up by various tests like the CT, MRI, biopsy, etc. You have a better fund of information to go back and talk to your physicians. Okay? Please, for the cardiologists and aspiring doctors in the field, I recommend highly to go back and supplement it with the texts and journals, but this was a quick nutshell I wanted to give you right before the exam or before the test or the Viva Voice. Okay, talk to you soon again. This is Dr. Jaitly on MuniMeterHealth, live on Facebook and YouTube. Enjoy and keep sharing. Thank you.